The CHKD Sepsis Alert tool will soon be changing its name to the Children at High Risk or CAHR Alert tool. CAHR not only helps predict and identify children at risk for sepsis, but also children at high risk for infection-related decompensation. You'll notice that some icons have changed, so let's review. When the CAHR alert fires in the waiting room, place the patient in a trauma bay, or, if unavailable, in a hallway bed. The provider and nurse assess the patient together and determine patient to be red, yellow, or green light activation based on status and history. Both complete their assessment forms, the provider selecting a stoplight color and nurse selecting assessment complete. Both assessment forms must be completed for the selected color stoplight to appear on the tracking board. So, the provider or team has assigned a stoplight to the patient. Now what? Stoplight activation procedures go into effect. These are guidelines for each color stoplight which outline what tasks need to be done and by when. They include things like IV access, vital signs, monitoring, treatment, and pit stop frequency. A pit stop is a team huddle with the nurse, attending, and ED tech to briefly discuss patient status and immediate plan of care. Frequency is based on color stoplight chosen and can also be requested at any time by a team member. To help activate teams for red or yellow stoplights, the provider lets the PAT know, then, for red, the PAT overheads red light and room number and sends one page to the nursing supervisor, charge nurse, pharmacy, RT, and VAT. The code team, VAT, and RT must respond. For yellow, the PAT pages the charge nurse and RT if directed. If the CAHR tool refires during the patient's ED or 1C stay, just repeat the assessment process. Remember, this tool does not replace clinical judgment. It simply helps alert and guide us to work together to identify and treat these at-risk patients early. Don't forget to reach out to your ED drivers if you have questions or feedback.